Let me give the first word to Dr. Balbir Singh. Dr. Balbir Singh, we've been tracking air pollution year after year. For me, the change that has come in has been the fact that though we are more aware, we don't seem to be seeing more sort of solutions. There is no pollution ka solution on the ground just yet. The baseline pollution level is what I'm talking about. Because overall, we see farm fires go down. We see farmers finally being aided with the right solutions. But how exactly is it that even this very poor category of pollution level and this AQI is doing to us? Let me take that question to Dr. Vivek Nangia first then. Dr. Nangia, we've seen you write report after report. We've seen doctors talk about how lungs of even young kids are turning black. But there are still some who feel that air pollution is not the problem, that our body will adapt in some way, some weird explanation that I keep hearing from people. What is the clinical advice that you are giving your patients?
So, Sonal, basically, first we need to understand that what all harms can air pollution do to our lungs, and not just the lungs, but the entire health of the entire human body. The effect is not just restricted to the lungs. When you have a larger particulate matter, like 10 microns and all, 10 microns and above, that usually gets filtered at the nasal level itself, and all it can cause is some kind of an burning in the eyes, uh, irritation, nasal congestion. A particle size between 5 to 10 would get stopped in the upper airways. So there it would usually cause cough, irritation. But a particle size less than 2.5 microns goes right into the lungs, triggers off an inflammatory cascade, which then impacts the entire body. That includes the brain, the heart, kidneys, liver, all organs of the body. And in fact, even predisposed to certain hematological cancers as well. So if we enumerate the various systems and the various diseases it can cause, starting from the brain, it can cause brain strokes, brain attacks, heart strokes, heart attacks. Similarly, asthma, chronic obstructive pulmonary diseases, hypersensitivity pneumonitis, lung cancer. Lung cancer is becoming increasingly common in the younger non-smokers. Conventionally it was considered to be a cancer of the smokers, but now as we see in non-smokers, it is more common, probably because of the air pollution around us only. And this impact is
Right.
also in pregnant ladies, especially when they're carrying a child in the womb. The child itself, even before being born, can be impacted with a slow development of the lungs, poor immune system, intrauterine growth retardation, and so many other complications. And as the child starts to grow, they start developing allergies, more frequent respiratory tract infections, and in fact, some pollutants can even result in mental retardation in the children. So the impact of air pollution is far and wide. If you see, there are studies which have actually shown that our lifespans have gone down by anything between 2 to 12 years. The average expected lifespans in people who are being exposed to this kind of an air pollution. So
Right.
I guess
Dr. Nangia, you talked about kids, which brings me to Dr. Nihar Parikh there, and I want to understand this. Dr. Parikh, we've spoken, like I said, year after year about how many kids are actually coming in with faults, or how many of them are coming in with, their body parts not functioning properly, and everything in some form or the other related to environment, related to pollution. I want a very specific answer to how much level of pollution starts impacting you immediately. Because, while we are showing the Delhi numbers right now, Bombay is no better. Mumbai, Bangalore, any metro is not better. In fact, I would go ahead to say that even tier 2 cities now, places like Kanpur and Lucknow are also getting worse because there seems to be no understanding of this problem in the first place. So at what level of AQI would you say now it's dangerous? Pack your bags and probably take a pollucation.
I mean, it's a round the year phenomena, especially but during the winters, you will have to have a vacation for more than 3 to 6 months because this is not going to get better. It gets worse year after year, year after year. The minute there is smog in the air, above AQI going above 140, 150, it is directly proportional to the kids walking into our clinic, the number of nebulizers prescribed, the number of inhalers started, the number of antibiotics for an infective cough, secondary to an allergic cough, is just exponentially and we see it the next day. The minute we see the clear skies turning into gray skies, the minute we look out of our work windows and we can't see buildings down the road, we know next day is going to be loaded with this. And this doesn't get better. As the winter sets in, as the firecrackers are, they set ablaze, and those in the north you have the crops being burnt, is just going to get worse. I have not seen clear blue skies for winter, at least in the last 3 to 4 years. COVID was probably the last time we had brilliant
Yes, I was
AQI.
just going to point out.
After that, I don't think it's going to get better. So
Dr.
the
Balbir
minute you hear
Singh.
100 plus,
Yeah, let me bring in Dr. Balbir Singh. Dr. Singh, there are still those who are not convinced. There are still those who are going to the Supreme Court to say, allow crackers, make it green. There are still those who are saying, ab to ye har saal hi hota hai. They've given up. They're saying, we can't sanitize every place. How long will we keep our kids inside the houses, not send them to school? To those people, do you have an argument? Do you have a way to explain why we should care about pollution? Why should we be very, very worried?
So I'm a cardiologist, so I can tell you that we always think pollution affecting the lungs. What we forget is that the commonest cause of death due to pollution is heart, not the lung. And why does pollution cause death? Because sets up an inflammatory reaction by those small particles that come in into the lungs. They set up an inflammation. Body says, I'm struggling to fight against a small particle which is not mine, so it has a cascade. It attacks that with inflammation. That inflammation hits the vessels which supply blood to the heart. This leads to heart attacks. So this is something very silent, and people won't understand how pollution is causing a heart attack because it is very simple to understand that it goes to the lung. So you need bronchospasm. So they think nebulizer is a solution. But what they don't understand is that it is reducing their lifespan. It is reducing mortality. And heart is a silent killer. It can cause a severe heart attack. And we know the London pollution, the first one happened, the heart attacks rose tremendously, and there were more deaths due to heart attacks than to lung problems. So we have to understand that this heart problem is a silent problem, and pollutants add to the fire. So it is like smoking. So if we say that please don't smoke, we also say that there'll be less pollution. So how do we compare? So people have to understand that it is not just cough, it is just not nebulizer which is going to help you. It is an increased risk of heart attacks and brain strokes both.
Got it.